today's topic is on hair restoration. So we have been actually remarkably pleased with the reception that we've had when talking about hair restoration. So commonly, hair restoration is exclusively something that's driven for males because male pattern baldness is what most people see. And what we've seen is that many of our patients, female patients in particular, have experienced a lot of hair thinning and some hair loss that is undesirable. And so Dr. Brandon has put together some great information about hair loss and how it relates to both males and females, and some of the myths that most of us have think that is true about hair loss. So in looking at it, I want to go through and just give you some information about FAC to start us off. So for those of you that don't know us, Facial Aesthetic Concepts has been around for 40 years in Orange County. We are a training facility for the University of California, Irvine. So we do have fellows from the American Academy of Facial Plastics that come in and they actually observe procedures within this facility. So this is where they gain exposure to facial cosmetic surgery. The UCI program focuses on reconstructive components of that program, and then Facial Aesthetic Concepts is where they observe cosmetic surgery. And we've been voted the best of Orange County for 13 years. We have two facial plastic surgeons, Dr. Richard Gagnes, as well as Dr. Brian Brandon. They're both board certified surgeons, specializing exclusively in facial plastic surgery. In addition, we have three dermatologic specialists. We've got Sharon, Christopher, Cassandra, as well as Haven. They are all focused on non-surgical aspects of the aesthetic practice. And so that's things like Botox and filler and a lot of other procedures that we do here in form of lasers and many other different technologies. We also have 5 medical estheticians. Now, I only have 3 of their pictures up here because we are waiting on some new imagery for the other 2, but we have 5 medical estheticians that do all manner of different skincare procedures with our organization. And many of you may already know these individuals. We have 3 offices, that's San Clemente, Aliso Viejo, and Rancho Santa Margarita, as well as an accredited surgery center. So our surgery center accommodates board certified surgeons, and we do multiple different specialties. And we also have an overnight suite, making it very comfortable for our surgical patients to stay overnight with us, as well as one of our nurses. So we do offer a comprehensive array of aesthetic services. And one of the things that's always astounding to me is that many of our patients, even those that have been here for years and sometimes decades, aren't familiar with the breadth of services that we offer here. So we offer everything from facial plastic surgery, which includes minimally invasive facial procedures such as a microlift, rhinoplasties, neck lifts, fat transfer, as well as breast and body contouring. In addition, we offer a comprehensive array of non-surgical aesthetics, and non-surgical aesthetics is really an area that has expanded considerably in the last several years, let's say 5 to 8 years, because of the advent of new technology that makes improved results with less downtime, which is really what many patients are after. And that's what our focus is, both surgically and non-surgically, is to produce the best possible outcome for our patients while minimizing the impact on their social lives and any downtime that may be necessary. In addition, we do offer skincare services. This is what our estheticians do. So we do customized facials and have our own customized skin peeling solutions, so chemical peeling solutions that are varied depending upon the overall result we're looking at for our patients, as well as microneedling, microblading, and we do offer a full array of cosmeceutical products. So on that note, I want to do a brief introduction to Dr. Brandon. So Dr. Brandon is a board certified surgeon. He went to the Cal Poly San Luis Obispo and got his BS in biomedical engineering. He also attended locally here his medical school. So he is a UCI School of Medicine graduate and got his doctorate there. He then moved to North Carolina, where he completed a head and neck surgery residency. And then he also completed a fellowship program with the American Academy of Facial Plastic Surgery. And what that involves is a specific program where he's learning exclusively and practicing exclusively in facial plastic surgery. In addition, Dr. Brandon has done over 250 facial rejuvenation procedures in the last 18 months. He's done over 800 eyelid procedures, over 160 rhinoplasties, as well as over 100 neck lifts. And he recently, I believe this was about a year ago, completed his volunteering mission out in Guatemala. And you see him here with one of his happy patients. So Dr. Brandon has recently joined our practice. He's an outstanding individual, wonderful surgeon, and we're pleased to have him presenting today on hair restoration. So on that note, I'm going to go ahead and pass it over to Dr. Brandon for him to start going through our today's topic.
Hi there, everyone. Can you hear me?
We can hear you, yeah.
Great. Let me share my screen.
It should be coming over right now, Dr. Brandon.
Okay.
You should be able to make that selection now.
I don't see it just yet. Oh, here we go. Share screen. All right,
Beautiful.
how's that looking?
Yep, we see your screen. There you go.
Oops, it backed up. Let me go through. Thank you for the nice introduction, Chris. I really appreciate it. So today I'm going to talk to everyone about the myths regarding hair restoration and hair loss, because there's a lot of misinformation out in the public about these topics, and it's actually a pretty complex topic. So I'm going to try to demystify things and educate everyone on what causes hair loss, what doesn't cause hair loss, and what we can do either to prevent hair loss or to regain hair that you have lost. So I'm going to do this hopefully in kind of a fun method and not be too academic, but go over the 5 hair loss myths. The first being hair loss only affects older men. Second, the common misconception that your hair loss pattern is going to be the same as your maternal grandfather's hair loss. Then some other common myths about, things that might cause hair loss, such as wearing hats, that vitamins can help your hair grow, and finally, that hair restoration surgery looks unnatural. So before I get into the meat of the talk, I do have to go over some basic anatomy, and I don't mean this to bore anyone or get too academic, but I do think it'll help you understand when I get a little further along into the treatment options that we have. So the basic anatomy of a hair follicle is actually a little more complex than most people realize, but it's the triad of the actual hair follicle, the hair shaft, which is the shaft of hair that comes through the skin, the follicle down below. You actually have a sebaceous sweat gland, so that's why you sweat in hair-bearing regions, and then a little muscle called the erector pili that was responsible for you having your hair stand up on end, either when you're scared or frightened or cold. So that's that muscle. And interestingly, hair does not grow in a single hair follicle in a single hair shaft. They actually come in pairs or groupings, most commonly in groups of 1 hair shaft, 2, 3, or 4. And you can actually see that. So these are individual hair grafts. This is a single hair shaft follicle. This is 3 hair grafts per follicle, and here's 2. And so you can kind of see how they're grouped, and you can actually see how they come down. And this is important for hair restoration surgery, and I'll show you why that matters later on. Now, you have 2 different types of hair in your scalp. The main hair that you have is called a terminal hair, and that's your normal hair. That's the thick colored hair that gives you the nice density to your hair. But you also have, to a lesser extent, a type of hair called vellus hair, and that's basically baby hair. You may notice baby hairs in the front of your hairline or in areas where you're thinning or losing hair. And there's a reason for that I'll go into. And all of your hair goes through a growth cycle. It's essentially a 3-step phase. You have anagen, which think like anabolic steroids. So someone who's taking testosterone, they're bulking up, they're growing. So anagen is like that. That's the active growth phase. 90% of the 100,000 follicles that you have in your hair are in anagen. They're in the growth phase. They're just doing their thing, growing. And that's actually a pretty long phase. It lasts 3 to 4 years. The second phase is catagen. It's the opposite of anagen. It's where the hair follicles actually start shrinking. They go from that nice, big, thick, colored hair follicle down to a small, short, colorless, miniaturized hair, and that's the vellus hair that I was talking to. That process actually is very short, only lasts a couple of weeks, and only 1% of your hair is in that process. And then finally, the last step, which if you can see my mouse right here, is telogen. And that's where the follicle actually stays alive, but the shaft breaks off and goes away. And so a very small percentage of your hairs, about 10%, are in this telogen phase where the follicle is still present, much like a seed that you may have planted in the ground, but there's no grass that's grown or no hair that's grown yet. So once it gets through that phase, it'll kick back into anagen, which is represented by this one, where the hair is thick and growing again. The last thing I wanted to point out on this slide is that hair growth is very, very slow. About 1 millimeter every 3 days, so maybe 2 millimeters a week. And when you come in for a consultation and we talk about different treatment options, that's why you will commonly hear me say, you're not going to see a drastic improvement for 3 months, 6 months, 9 months, even a full year after whatever treatment that we initiate. And that's partially because hair just takes a long time to grow. So now with all the anatomy out of the way, we'll talk about the myths. So myth number 1, hair loss only affects older men. That is not true. Now, while it is most commonly for men, in fact, by the time you're 80 or by the time you're 70, the vast majority of men will have some amount of hair loss, but hair loss can start much, much earlier, well into your late teens and early 20s. And so, by your age 30% of men are going to have hair loss. By age 50, every other man is going to have significant hair loss. And then, as you get older, the majority of men. It's very common in women as well. Not quite as common as men, but a good 12-15% by the age of 30, and over a quarter of women by the time they're 60 are going to have some amount of female pattern hair loss. That's not even counting other types of hair loss. So that brings me to the causes of hair loss. Now, by far and away, the most common cause of hair loss, like 95% of hair loss, is called androgenetic alopecia. And that is hair loss that is genetically determined and hormonally determined. So you have hair in your scalp that is essentially genetically predetermined to fall out over the course of your life when exposed to a byproduct of testosterone, which is called dihydrotestosterone. So your body makes testosterone, and then that testosterone is actually converted to dihydrotestosterone in the scalp. The certain follicles in your scalp are susceptible to that, and it causes it to fall out. And they found out that it was not only hereditary, but hormonally mediated when a researcher many, many years ago studied men who were castrated. And they found out that these men actually never lost their hair. And it's because the testosterone is made in the testicle. And when you're castrated, obviously you don't have that. So I don't know if anyone is a Game of Thrones fan, but you have the character Varys here, who is in the show. He is a eunuch, so he has been castrated as a youth, unfortunately for him. But it's funny, they made him bald. So he didn't lose his hair through the most common pathway. He must have lost his hair some other way, or it's just a kind of a mishap in casting, I suppose. But that is to say, there are many other reasons for hair loss, and it's also a good reason as to why you should be evaluated for your hair loss, because you can't just always assume that this is just run-of-the-mill male pattern baldness. There are many other types of hair loss. Telogen effluvium. Now, this is essentially hair loss that is caused by a stressful event. This could be surgery. This could be an illness. This could be even a psychological stressor. Say you are just really stressed. You lost a family member. You lost your job. You're moving. Anything like that can cause a large amount of your hair to go into the telogen phase where your hair just starts shedding. And it got quite a bit of media attention this year because it's associated with COVID. So there are a lot of patients who had COVID who are losing a lot of their hair. This is not unique to COVID in any means. It's just got a lot of media attention because COVID is being covered nonstop. But it's described in other viral illnesses too. Fortunately, that type of hair loss does tend to come back. There are things we can do to help it come back quicker, but in general, it'll come back on its own once the stressful event is over. Now, more concerning are the scarring alopecias, or baldness due to like an autoimmune type disorder. And I'm not going to go into them, but the reason I bring them up is that just initiating a hair treatment plan without considering these more rare types is doing a patient a disservice, because you will not respond to the traditional treatments, and things could get worse before we actually figure out what's going on. So those are a little more rare, but definitely something that we think about. And then finally, infection. Most commonly a fungal infection like Tinea capitis, and then traction. If you tie your hair in very tight braids, it actually can pull on the hair follicles enough, it cuts off the blood supply and the hair follicle dies. So that's a common thing. All right, so myth number 2, your hair loss will be the same as your maternal grandfather. So that's a very common misconception. That's what used to be taught actually in medical school, and they have found it's not true. It's actually what's called a polygenetic trait, meaning it's inherited from all different parts of your family. So, the traditional teaching was if your grandfather on your mother's side had a full head of hair, you were going to be fine. Not true. You could have an uncle who's totally bald, and you could have inherited that sort of genetic predisposition, and you could have a balding pattern that looks like an uncle, or your father, or a brother, or a sister. Just be aware that it's possible that your hair loss pattern can follow different family members, and it's important to know because that is going to change how we plan to treat your hair loss. So, common patterns. This is the traditional male pattern baldness, where this man is having basically end-stage male pattern baldness, where you have just a horseshoe of hair around the sides of the head and the back of the head, but the entire front and center of the scalp is entirely bald. This is exemplifying female pattern baldness, which is hormonally mediated as well, but probably not quite as clear-cut as male pattern baldness. We think that there's more involved in this type of hair loss, but very commonly seen in females, and you get central loss, but sparing of the frontal hairline. So you still have hair here, but a lot of hair loss going on in the center of the scalp. So myth number 3, wearing hats that can make you lose hair. Definitely not true. And some other things that don't make you lose hair: shaving, blow drying, frequent hair washing, use of styling products. None of those things have actually scientifically been shown to cause hair loss. And as a side note, another common thing that people hear from Family members is don't shave. That's going to make your hair grow back coarser, thicker, darker. It's absolutely not true, because if you think about it, if it were true, all the bald guys would be walking around shaving their head, hoping that their hair would be growing back thicker, coarser, and stronger. So definitely not true, unfortunately. Next, vitamins help your hair growth. There's a huge industry around this. And unfortunately, there's not really any good scientific data that supports it. Now, I'm not going to tell you that you shouldn't take, Nutrafol or biotin supplements or multivitamin supplements, but I also don't want you to hang your hat on it and think that that's really going to make a huge improvement. It may improve the quality of the hair, but it's not going to so much regrow the hair. So, these are marketed for skin, hair, nails, but don't show a huge improvement. What has shown an improvement to some degree is vitamin D and iron if you are anemic. Anemic is a possible cause of hair loss. And if you come in for a hair consultation, particularly if you're a female, we'll probably run a basic set of labs to look at your iron studies, your thyroid, and your electrolytes to make sure that there's no underlying medical issue that could be causing your hair loss. And again, I don't know if there's any Anchorman fans here, but they do say that 60% of the time it works every time. And unfortunately, I think that's somewhat true for vitamins for hair loss. So what does actually work? Now, the mainstay for any sort of hair loss is Finasteride, marketed as Propecia, or Minoxidil. Finasteride is probably the most effective oral or topical medical treatment that you can start for male pattern hair loss. It can be used for females too. You just have to be sure that as a woman, you are not going to be having any kids, because it has been linked to birth defects. So you either you have to be postmenopausal essentially for me to recommend Finasteride for women, but it works extremely well for both men and women. The next is Minoxidil, which is commonly marketed as Rogaine. Can be taken as an oral form or as a foam or a dropper topically. And it is also FDA approved for both men and women. And it's interesting, it was discovered because it's actually a blood pressure medication. So it was being given to men as a blood pressure medication, and that was helping their blood pressure. But they noticed that men were growing their hair back when they started this blood pressure medication. So someone ground up the pill form of the Minoxidil, put it in a foam, and called it Rogaine, and that's how you got Rogaine. And so there are other formulations and there are other medications less commonly used. So ketoconazole is actually an antifungal, but it actually has a anti-androgenetic component too. So it'll kind of tone down the testosterone feeding the hair loss. Spironolactone is used for women maybe with PCOS, polycystic ovarian syndrome, that's associated with hair loss. And dutasteride is a sort of a stronger form of finasteride, but it does come with more side effects, so it's not used as commonly. Now, one nice thing that we offer here at FAC is we will combine all these different medications, and we'll make a specific, individualized, personalized treatment for you that you can apply topically. The nice thing is you get the same efficacy without the side effects, and all combined into one dropper, so that you don't have to be applying multiple different things or taking different tablets. So we can be pretty creative in customizing the treatment for you in that standpoint. And I'll show you some pictures in a little bit that demonstrate how powerful these topical solutions can be. So just to be aware, finasteride, when taken orally, can be associated with sexual dysfunction. We're talking about decreased libido, erectile dysfunction, breast engorgement, and that's very, very rare, and it generally subsides within 6 months of using it. But That being said, a lot of young men don't want to use it for that reason. So we've switched over to using finasteride topically. So it's not absorbed into the bloodstream in any real appreciable amount. And we have used it for quite a while and had some very nice improvements in hair loss. And I've had no patients that I know of that have had any of those such side effects using it. So I do think it's much safer than the oral version. Minoxidil or Rogaine, you can get a contact dermatitis, which just means you can get a red, irritated, itchy scalp from it. And again, if you're one of those people that does happen, we can formulate a compounded topical solution that has a little dilute steroid in it that can counteract the contact dermatitis, so you can tolerate the minoxidil better than you would if you just use regular Rogaine. Now, laser and low-level light therapy sounds like voodoo, but it actually has been shown to work. And the way that this was discovered was people who were getting laser hair removal were actually coming back with paradoxical hair growth after treatments in the areas that were treated. So they found out that certain wavelengths of light actually stimulate hair growth, stimulate follicles to grow thicker, longer, more colored hair. And specifically that wavelength is 630 to 680 nanometers. And you can find all different types of systems online at different retail stores. Just be aware, if you're going to use one of these systems, you have to use it very consistently. And you get what you pay for. The number of diodes and the type of diode that is used is pretty directly correlated to the type of response that you will get. So, you know, if you go for a cheaper brand, just realize that it probably is not going to move the needle as much as maybe a more expensive model. We carry a specific brand called Theradome, which we've had some very nice results with over the years. And I like it quite a bit. So that's an option if you want to treat your hair loss with a multimodality type therapy, which I think is where you'll get your best improvements. A Theradome helmet may be a good option for you. The nice thing about it is you wear it at a minimum 2 times a week, at the most every other day for about 20 minutes. It's battery powered. You can do it in your commute. We have some patients do that, or at home while you're relaxing, watching TV in the evening. And it works synergistically with Rogaine and Propecia and these other therapies that I'm going to talk about. So it can be quite powerful, actually. The next step up, so say you've started using the Rogaine or Minoxidil or the laser cap, then PRP is the next step up. And this is where you would actually come into the office. We would draw your blood, we spin the blood down. We get this part of the blood that has the platelets in it. The platelets contain growth factors, and when injected into the scalp, those growth factors are released and stimulate the hair follicles to grow. So it can actually be a very effective treatment. You may have seen it used in many other fields. People are getting PRP injections in their joints, and the orthopedics and dermatologists are using it very frequently. We use it in aesthetic, cosmetic surgeries all the time. It's very safe and very effective. Just realize that it generally takes 3 to 4 treatments before you really see much improvement, and then requires maintenance for the best results. So most patients will come in once every 6 weeks or so for a series of 3 treatments or 4 treatments. And then after that, you'll get a treatment every 6 months to 12 months, depending on how much of a response that you've gotten from it. So this is an example of a patient of mine, young patient, about 30 years old. I don't have the picture of what his hair looked like when he was young, but he came in and he was able to see the scalp through his hair. Now, the interesting thing is, by the time your hair is thin to this point where you're actually visibly noticing the hair loss, you've probably lost about 50% of the hair follicles in your scalp. So you've lost a massive amount of hair by the time you actually notice it. The good thing is, you don't have to regain that 50%. So then have a good looking head of hair. There's a difference between the actual density of hair follicles and the optical density of hair follicles. So we're just trying to add, a couple percent, 5%, 10%, 15% to where your hair looks thick again. And so this patient did one of our topical compounded formulations with Finasteride, Rogaine, Minoxidil, as well as PRP. And just after 6 months, a huge improvement of hair loss. So if you're a younger patient who is just starting to show the signs of hair loss, this is a great option for you. You're going to be able to keep your hair looking thick, healthy, and for much longer. That brings me to how I frequently describe what hair loss is sort of like. Now imagine you're in a car going 60 miles an hour down the freeway, say from here to San Diego. You're going to get there in an hour, hour and a half, something like that, depending on traffic. Now think of that as your genetic predisposition to hair loss. You're going to get from point A to point B, and it's going to take a certain amount of time. So you are going to lose a certain amount of your hair no matter what over a certain amount of time. Now doing minoxidil, finasteride, PRP, all of these medical treatments can slow down that hair loss. So say instead of going 60 miles an hour and getting there in an hour and a half, you're going to slow down to 30 miles an hour and you're going to get there in 3 hours. You're still going to get to from point A to point B, but it's going to be much, much slower. So for a young patient, starting early on these therapies can really slow down your hair loss. We have recently started actually using a newer system that I love. It's called PRF. It's the same concept, but we're using a slightly different part of the blood that we draw off from you. And it's the part of the blood that contains fibrin. So we draw your blood, we spin it in the centrifuge for about 10 minutes. We draw off the component of the blood that we want that has the platelets and the fibrin, and we inject that into your scalp. The nice thing about this system is it's 100% all natural. There's no additives, no preservatives that sometimes are added into things like PRP, depending on which practice you go to. And so it's completely all natural, and there's a prolonged release of growth factors. So whereas with PRP, you get a very quick flash of release of growth factors over a couple hours, with PRF, you get this sustained release of growth factors over days to weeks. So we think that that's actually had a pretty significant improvement in the results that we've seen. This is one such result. This is really only after 4 months of topical therapy with one of our compounded formulations and 2 rounds of PRF. And it's fairly impressive. Even with him parting his hair, you can see all this thinning. See, these are the little vellus hairs that I was talking about early, these little baby hairs. All of these therapies kick those hairs back into the growth cycle. So it makes them look bigger, more colored, and thicker in caliber. So you just get much more improvement in the hair that you have, not only new growth of hair, but improvement of the existing hair that you have. Another patient that we had with multimodality treatments with PRF. And you can see the before here on the left, some pretty significant temporal recessions. Probably some thinning through here. This is again with him head down, and he's got a full head of hair. It's like completely reversed the process for him. And finally, the last myth, hair restoration surgery looks unnatural. So back when hair restoration started, it did get a reputation for looking like this. These are, the doll's hair sort of look, where they actually took 4 millimeter, 5 millimeter punches of hair and transplanted it up to the hairline. And so these hair plugs looked terrible, and they screamed hair transplant. This is what a hair transplant should look like now. You see the temporal recessions, the loss of the frontal hairline on both sides here is filled in and looks totally natural. And that's because we don't take a big punch. We take an individual follicular unit and transplant that from the back of the head to here. And so it has the ability to look completely natural, and can be very difficult even for myself to, identify transplanted hairs. So there are really two mainstay treatments today that are still used. There's the first type, that's follicular unit transfer, also known as the strip method, or maybe most commonly known as the type that leaves you with a linear scar on the back of your head. And that's probably being done less commonly now, but it's still a very powerful procedure, and I may still recommend it depending on your hair type and your goals. And it's actually commonly used for women because, as I'll get into later, you have to shave a big area of the back of your head to do the scarless type that we use with NeoGraft. And so a lot of women don't want to have to shave the back of their head, reasonably so. The second unit the second method that I alluded to is called follicular unit extraction. That is being demonstrated here in this photo, where we are using a 1 millimeter or 0.9 millimeter, almost like a Dremel tool, to actually remove each individual follicle from the back of the hair, where you have plenty of hair and you're never going to lose this hair, and it's going to be transplanted to the front. And I'll go over that here in a second. So here's that strip technique. We actually shave the area that we're going to take out, and we cut an entire strip of the scalp out right here. After that that's sewn together, so then you'll have a very fine linear scar. You can actually see this patient's scar right underneath the purple line there. That's from his prior strip. So that scar can actually look very, very good and be very well concealed. And we can actually do multiple of these procedures. Say you do one session when you're younger and another session when you're older. We'll just incorporate that old scar and take that out so that you're not left with a bunch of separate scars on the back. Once the strip of hair-bearing scalp is taken out, we have a team of technicians, highly trained technicians, who will actually divide that strip of hair up into each individual follicular unit, which is shown here. This is the same picture that I showed you earlier. So first they're sectioned into these little strips, and then the technician actually divides them along in each of their little follicular units. So as you can see, this hair has 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 1, 2, 3, 4, 1, 2. So this person's going to get a fantastic result because each follicular unit has 4 hairs. So each transplanted graft that we're doing is not just 1 hair. It's, on average 2 to almost maybe 3 if you're lucky. It just depends on your hair. So the scarless technique, and I can't quite say exactly scarless, but almost scarless, it really depends on your skin type, is what we use most commonly. And we use the NeoGraft machine. And like you saw in that other picture, there's a safe site that you can harvest from. Right here, it tends to be kind of in the mid area of the back of the scalp. This hair is never going to be lost. No one, even with the worst hair loss patient, they're going to hold on to this hair. And so they have a very high density of hair there. We basically are taking every other hair or every couple hairs from back here. So, and strategically, so that it doesn't look like you're missing any hair from the back of your scalp. And we're going to be transplanting it up to where you're having a hair loss, most commonly in the front of the hair, but sometimes up on the top and the crown as well. This is a video of that actual process. And you can see all the little individual follicles that have been harvested. And this is the NeoGraft machine. The follicle is, we line it up with the shaft of the follicle, and we basically drill down right here to the end of the follicle, and then the NeoGraft machine actually suctions that follicle up. Once that has happened, we collect all the follicles, and they're organized into 1 hair units, 2 hair, 3 hair, 4 hair. And depending on the ratio of the hair that we get, we'll put specific types of hair in the front, in the mid, and in the back, depending on where you need the density the most. So that brings me to what hairline design is. And this is one of the most important things when you come in for your consultation. If we're going to go the hair restoration surgery route, we have to decide, what is an appropriate height for your hairline. And there's a lot of different ways of doing that, but generally it's 7 to 10 centimeters from this region in between the eyebrows up to there. A lot of times people will have a few straggler hairs there that give me a good idea of where that hairline will be. And you and I will decide what is a very natural looking hairline. If you came in and asked for a hairline down here, we would have to discuss what's reasonable and what looks natural. And again, some men are very conscious about the temporal recession here, and they're going to want this rounded out. Just be aware, I will discuss with you that a rounded hairline here is more commonly seen in women. It's actually normal to have a small amount of temporal recession here for a man. And so we'll go over the intricacies and the specifics of your hairline design, and it depends on what your goals are, what you want to achieve. This actually shows how we make that natural hairline. So after we have decided where that hairline is going to start and stop, you will see that it's not a straight line. And again, that is to make this look as natural as possible. We'll actually place small little single hairs out in front of the hairline, because if you look at your hairline very closely, it's not like a forest where it just starts and stops. It gradually starts, and then as it works into the hairline, gets thicker and thicker. So we recreate that, and there are actually little undulations along the hairline, and that actually enhances the natural appearance of the hair. And we go to great lengths to make sure that this appears as natural as possible. So some nice options. This is a patient. You can see he's thinning through the front of the hairline and then has deep temporal recessions here on the side of the head. This is just after 500 grafts, and I'll show you one more picture. After 1,500 grafts, much more robust results. This is a result that in an older male, I do not think you could get with medical treatments. This is a close-up of that so that you can see the improvement. Now, of course, hairstyling and everything has something to do with it, but there's an obvious huge improvement in the number and quality of his hairs and his scalp. Now, this is not just for men. Women have hair loss too, and this is the classic female pattern hair loss. See, notice how her hairline is spared in the front, but she's starting to lose a lot of hair at the top of her head. So this is actually after a much larger session of about 2,000 grafts. You can see how she was losing all of this hair, and now it's much fuller. And she may decide she wants another session down the road, and we could fill this in even more. But again, huge improvement here. She's thrilled. We're thrilled. So in conclusion, hair loss is most commonly due to genetics and hormones, but you really need to have a complete evaluation before discussing initiating treatment. There are many options to treat hair loss, both surgical and non-surgical. And when you come in for your consultation, we will talk about both depending on your goals. And that's sort of our view. There are practices that all they want to do are hair restoration procedures, or other practices that don't do the grafting procedures, and they only do the medications, or they only do PRP. Here at FAC, we have a comprehensive hair restoration practice, and we can treat just about any hair restoration problem that you may have. So thank you for your attention. I really appreciate it. I want to know if Chris
at this time, if there are any questions. Thank you, Dr. Brandon. That was really insightful. I think I need to come and see you for a consultation. As a matter of fact, as I'm walking through this thing, I'm like feeling my head here. I don't know. It's You know, it looks intriguing, something I hadn't considered recently. So if anybody has any questions, if you could please drop those in the chat box, we'll be happy to answer any questions that you may have. We do offer, as part of today's program, for those of you that have participated, you can schedule a consultation with Dr. Brandon, and we have worked with our vendors in order to get some special discounts or special offers for you. So you can get $200 off that Theradome. That is the product that is the LED light therapy helmet that we use within the office here. It's an outstanding procedure. We have great results from our patients who have actually just used that, and then also those that have used that in combination with the other therapies, as well as an opportunity to get $500 off a neograft procedure, and that is the follicular unit extraction procedure that Dr. Brandon had mentioned. So again, thank you so much for joining us today. If there are any questions, we'll give it just a moment in the chat box here. As we close up here today, there are a couple things I was hoping that you could do for us. Following the session today, there's going to be a short survey that you will receive. If you could please help us out and provide some information about what you thought about today's procedure, and also what it is that we can do to have another seminar, another presentation on topics that you might be interested in. These are oftentimes really fun for us, very educational for you, and we appreciate your participation and want to do them more often. So thank you very much for attending, and we'll get that email out to you shortly with that survey. And any other questions that are coming through right now? There's one question. What is the typical number of grafts that you do with the neograft?
It's highly variable. It really depends on what your goals are, how much donor supply you have, how much hair you actually have back in the back of your head, and how much hair loss you've had up in the front or the top, and what your goals are. If there's a specific area that bothers you, or if the whole thing bothers you, it can range from 1,000 grafts up to 2,500 grafts in a single session. You may hear about mega sessions, typically done in other countries. Beware that those sessions are frequently, they're borrowing hair from all over on the body, arms, legs, chest, back, and they're putting those hairs in your scalp. The thing to worry about that is it's sort of like planting flowers or grass or trees or whatever. If you put too many seeds too close together, they're going to hog up the nutrients from their neighbors, and they may not all grow as well as they could. So there's a balance between putting as many grafts in as you can versus restricting nutrients and blood flow to the grafts that you put, and putting fewer high quality grafts in that are all going to survive.
Gotcha. Here's another one. Dr. Brandon says, is there a benefit to light therapy on the sides of the head? Most devices I see are only for the top of the head.
Yes. Yeah. So, it depends on the type of hair loss you're having. If it's the androgenetic hair loss, most of your hair loss is going to happen more on the top and less on the sides. So if you are having hair loss on the sides, it could be related to something else. So, you may want that to be evaluated. The Theradome could help there, probably not as effective though.
Excellent. Well, I think that is it. That's all the questions that we have for right now. Thank you everyone for attending. Thank you, Dr. Brandon, for the great presentation, the education. We will look forward to seeing you all soon, and we'll see you in the follow-up emails. Thank you very much.
Thank you, everyone.